Welcome to this program on basic oral hygiene, or how to have a beautiful, healthy smile. This program will teach you everything you need to know to keep your teeth and gums healthy and your breath smelling good for the rest of your life. It was written with the help of the members of the Alaska State Dental Hygienists Association. It was produced by Dr. Rebecca Poling of the International Training Institute. Chapter 1. A Healthy Mouth.
What is a healthy mouth? This mouth is healthy because there is no plaque, no decalcification or decay, no gum disease, and the teeth are straight and the bite is good. Is your mouth healthy? Look in your mouth. Is there plaque on your teeth, in between your teeth, or along the gum line? Is there decalcification or decay? Are your gums swollen, red, and bleed sometimes? Are your teeth straight, and is your bite correct?
Chapter 2. Plaque.
What is plaque? Plaque is a slimy, fuzzy, tooth-colored film of germs that forms every day on your teeth. Where does plaque come from? Plaque forms from the bacteria or germs in your mouth organizing on your teeth each day. Food and sugar that you eat and drink are also in plaque. The more sugary snacks and drinks you have, the more plaque you form on your teeth. The more you drink sweetened soda and have sugary snacks, the more bad destructive plaque you will form on your teeth than someone who doesn't have sweetened drinks or snacks. What does plaque do? The bacteria in plaque use the sugar in sweetened drinks and snacks to make destructive acids and poisons that cause decalcification, decay, and gum disease. Do you have plaque on your teeth? Look in your mouth and check for a fuzzy, tooth-colored film on your teeth, especially along the gum line and in between your teeth. It can be hard to see. You can use a disclosing agent to stain the plaque so you can see it easily. Try scraping off the plaque with a toothpick. Does a creamy clump of plaque collect on the toothpick? Notice where the plaque is. It usually forms first where it can hide along the gum line and between the teeth. This is where you could develop decalcification, decay, and gum disease. This is where you have to focus in brushing and flossing to remove all of the plaque. push in a Q-tip with a few drops of disclosing solution. The two-tone solution shows the new plaque as a pink color and the old plaque that has been on your teeth for a few days as a purple color. Dab the disclosing solution on your teeth and along the gum line. Rinse. Look at your teeth. The pink-stained areas are new plaque and the purple areas are old plaque.
Chapter 3, Decalcification and Decay.
What is decalcification? It is the early stage of decay where the surface enamel or hard outside covering of a tooth is broken down and a white, weak area remains. What is decay? It is a hole through the enamel or hard outside covering of a tooth into the softer dentin under the enamel. If this hole is not fixed by a dentist, it will get so bad that it kills the tooth and hurts. What causes decalcification and decay? Both are caused by plaque germs using sugar to make acids on your teeth that burn holes in the tooth enamel or hard outside covering of the teeth. Decalcification is the early stage where the acids do not go through the enamel. Decay happens when the acids from the bacteria burn holes all the way through the enamel and get into the softer dentin under the enamel. Then the bacteria eat into this soft dentin, spread out fast, and cause a big cavity. Another name for decay or a cavity is caries. Do you have decalcification or decay in your mouth? Do you have any decalcification or white areas that won't scrape off on your teeth or along the gum line? Or do you have any holes or decay in your teeth? Sometimes decay hides in the deep grooves of the tops of your teeth or in between your teeth, and you can't see it. A dentist must closely examine your teeth for you to know for sure if you have any cavities. How can decalcification and decay be prevented? By scraping the plaque off your teeth and from along your gum line each day, by limiting how often you have sugary drinks and snacks, by strengthening the teeth with fluoride, and by placing sealants on the tops of the teeth to seal out the bacteria.
Chapter 4. Gum Disease.
What is gum disease? It is an infection of the gums caused by poisons made by the bacteria in plaque using sugar from sweet drinks and sugary snacks. What is gingivitis? Gingivitis is the early stage of gum disease where just the gums are infected. The bacteria in plaque left on the teeth along the gum line use sugars that you drink or eat to make poisons that infect the gums. These poisons from the plaque bacteria using sugars cause the gums to get red, swell up, and bleed easily. What is calculus? When the plaque bacteria are left on the teeth and along the gum line, the plaque gets hard or calcifies. Then this hardened plaque is called calculus or tartar. It often collects on the inside of the lower front teeth, on the outside of the upper molars, and deep underneath the gums. You cannot brush off this hardened plaque. A dental hygienist or dentist must scrape it off. What is periodontitis? Periodontitis is the advanced stage of gum disease where the bone surrounding the teeth is destroyed. If plaque and calculus are left on the teeth, gum disease gets much worse. The plaque bacteria actually go down deep into the gums, causing infection and destruction of the bone that holds the teeth in the mouth. This advanced stage of gum disease is periodontitis and is shown here. The gums are red, swollen, bleed easily, and have calculus underneath and can smell really bad. But periodontitis does not hurt. You may not even know you have it. Periodontitis can get so bad that all of the bone holding your teeth in your mouth is destroyed so that your teeth get loose and fall out. What causes gum disease? Bacteria in plaque left on your teeth along the gum line use sugar in sweet drinks and snacks to make poisons that cause the gums to become infected, form calculus, and eventually go deeper and destroy the bone around the roots of the teeth. Do you have gingivitis, calculus, or periodontitis? Are your gums red, swollen, and bleed easily? If they are, then you have gingivitis. Do you have calculus or hard tartar deposits on your teeth that you cannot brush off? Does your breath smell bad? Are your teeth loose? Then you may have periodontitis. How can gum disease be prevented? Gingivitis and periodontitis can be prevented by scraping all the plaque off your teeth inside, outside, and in between, and from along your gum line each day. How? By thorough brushing and flossing every day. By having regular dental care to have calculus removed by a dentist or dental hygienist. By eating lots of fruits and vegetables rich in vitamin C and limiting how often you have sugary drinks and snacks. By not smoking, which actually cooks your gums, or using tobacco products which poisons your gums. By controlling health conditions like diabetes that can affect your gums.
Chapter 5. Toothbrushing and Toothpaste.
Why do we brush our teeth? To scrape plaque off our teeth each day, which will prevent decalcification, decay, and gum disease. It also makes our mouth feel fresh and smell good. How do we brush our teeth? Remember always to use a soft toothbrush that will not hurt the gum tissue. Use a toothbrush that is not too big to fit into the small areas of your mouth. Hold the toothbrush handle with a firm grip. Place the soft brush bristles at a 45-degree angle to the gum line. This allows the bristles to get into a little hiding area for plaque called the sulcus that is between your gum and tooth. Next, brush along the gum line, moving the brush bristles back and forth using very short strokes. You can add a small circular movement or even just wiggle-jiggle the brush bristles into the sulcus. Brush all around the outsides of your upper and lower teeth. Then brush at the gum line all around the inside of the upper teeth and lowers. Brush on the insides of the front teeth too. Then brush on the biting surfaces to get the plaque out of the grooves of your teeth. It is best if you follow a sequence of brushing so you will not skip any areas. Brushing the outside corners or canine areas. If you use your right hand to hold the brush, be careful when you brush the right corner where your canines are, where it is awkward to hold the brush pointed into the gum line. Overlap the strokes here. To do double duty on the corners, point your toothbrush toward your back teeth on the right and turn the bristles into the gum line. Brush the back area, bringing the toothbrush forward. Brush your right canine area. Then switch your hand position to brush at your gum line across the front, but bring your toothbrush back to your right canine and get it again. Most patients miss this area. Place the soft brush bristles at a 45-degree angle to the gum line. Brush along the gum line, moving the brush bristles back and forth using very short strokes. Do double duty on the corners. Brush all around the outsides of your upper and lower teeth. Brush at the gum line all around the inside of the upper teeth and lowers. Circular brushing method. Place the soft brush bristles at a 45-degree angle to the gum line. Brush along the gum line, moving the brush bristles using small circular movements. Brush all around the outsides of your upper and lower teeth. Brush at the gum line all around the inside of the upper teeth and lowers. Wiggle-jiggle brushing method. Place the soft brush bristles at a 45-degree angle to the gum line. Brush along the gum line with a wiggle-jiggle movement of the brush bristles into the sulcus.
What is important about toothpaste? Because toothpaste is slightly abrasive, it is better in scraping off plaque and stain. You should not use so much toothpaste that it gets in the way of seeing what you are doing with the toothbrush. Also, you should spit out toothpaste rather than swallow it. What kinds of toothpaste are there? There are several different kinds of toothpaste available. Some contain fluoride, which strengthens the teeth against forming cavities and kills some of the germs. Some toothpastes also have special agents to reduce gingivitis and calculus formation. They can have a special healing agent in them to help the gums get healthier. Some toothpastes have desensitizing agents that reduce tooth sensitivity. Finally, toothpaste is usually flavored to taste good and decrease sulfur compounds, which may contribute to bad breath.
Chapter 6. Flossing.
Why do we floss? We use floss to remove plaque from between the teeth. Floss scrapes the plaque off the teeth, removing it mechanically from the in-between surfaces. How do we floss the upper teeth? To floss the upper front teeth, wrap it around your left index finger and your right middle finger so that 1 inch or 2 inches is exposed. Guide the sectional floss between your upper central incisors. Hug the floss around one in-between surface of one incisor, sort of making a C, then scrape up and down, going into the gum sulcus very slightly until you feel resistance. Then bring the floss out of the sulcus up over the papilla of gum and hug the floss around the other in-between surface of the other central incisor. Repeat the scraping up and down motion. Slip the floss down and out from in between your teeth and move on to the next area. How do we floss the lower teeth? On the lower surfaces, use both index fingers to guide the floss between the teeth. Wrap it around the in-between surface, making the C shape. Scrape up and down, lift it up over the gum papilla between the teeth to take it to the other in-between surface. Scrape up and down. Repeat the same process throughout your mouth.
You need to floss once per day to scrape the sticky plaque out and keep your teeth and gums healthy and your breath smelling good. Flossing. To floss the upper teeth, section off 12 inches of floss. Wrap it around your left index finger and your right middle finger. Wrap it so that 1 inch or 2 inches is exposed. With your left index finger holding the floss on the inside, pass the outside section of floss over your right thumb and guide the section of floss between your upper central incisors. Hug the floss around one in-between surface of one incisor, sort of making a C, then scrape up and down, going into the gum sulcus very slightly until you feel resistance.
Chapter 7. Oral Hygiene Methods when you have braces.
How does plaque collect around the braces? In addition to plaque's usual hiding places along the gum line and in between the teeth, with braces, plaque hides around the braces themselves and under the wire. Since more plaque forms when you have sugary drinks and snacks, it is critical that you limit how often you have sugary stuff when you have braces. Otherwise, when your braces are taken off, you will have lots of permanent decalcified areas, cavities, and smelly, ugly gum disease. Since plaque is hard to see, you should use disclosing solution occasionally to show you where it is hiding. Because it is hard to scrape off all of the plaque and it causes nasty decalcification, decay, and gum disease, you should brush your teeth several times a day and floss once per day. Disclosing with two-tone disclosing solution around braces. Moisten a Q-tip with a few drops of disclosing solution. Two-tone solution shows the new plaque as a pink color and old plaque that has been on your teeth for a few days as a purple color. Dab the disclosing solution on your teeth, around each brace, and along the gum line. Rinse. Look at your teeth. The pink-stained areas are new plaque, and the purple areas are old plaque that has been there for a few days. How do we brush our teeth with braces? To brush our teeth with braces, we use three-step brushing. Step 1 is like brushing your teeth without braces. Using a soft brush, point the brush bristles into the gum line at a 45-degree angle to get the plaque that hides in the sulcus. Move the soft bristles in very short strokes back and forth. For Step 2, rotate the toothbrush bristles so they are pointing down into the braces on your upper teeth and getting underneath your braces and wire, brushing back and forth. For Step 3, on the upper teeth, rotate the toothbrush bristles up underneath the braces and wire and brush back and forth using short strokes. On your lower teeth, Step 1, point the brush bristles into the gum line at a 45-degree angle to get the plaque that hides in the sulcus. For Step 2, on your lower teeth, rotate your toothbrush bristles up onto the braces and wire and brush back and forth. For Step 3, on your lower teeth, rotate the brush bristles down on top of the braces and under the wire. Brush around the uppers and lowers, inside and out. Brush the biting surfaces to get the plaque out of the grooves of your teeth.
two-step brushing with braces. Step 1 is like brushing your teeth without braces. Using a soft brush, point the brush bristles into the gum line at a 45-degree angle to get the plaque that hides in the sulcus. For step 2, rotate the toothbrush bristles so they are pointing down into the braces on your upper teeth and getting underneath your braces and wire, brushing back and forth. For step 3, on the upper teeth, rotate the toothbrush bristles up underneath the braces and wire and brush back and forth using short strokes. On your lower teeth, step 1, point the brush bristles into the gum line at a 45-degree angle to get the plaque that hides in the sulcus. For step 2, on your lower teeth, rotate your toothbrush bristles up onto the braces and wire and brush back and forth. For step 3, on your lower teeth, rotate the brush bristles down on top of the braces and under the wire. Again, move the brush back and forth, pushing the bristles into all areas, especially in between the teeth, as much as possible.
How do we floss our teeth with braces? How do we clean between our teeth with braces? You must thread the floss under the wire to take it between your teeth using a floss threader. Some floss is made with threader on one end. Wrap it around the finger outside of your mouth so about an inch is between your two fingers. Wrap it around one in-between surface, making a C. Scrape the floss up and down, removing the plaque. Move the floss over the gum papilla and hug it up against the other in-between surface. Scrape up and down.
Flossing with braces. With normal floss, you have to slip the floss in the loop of a floss threader and insert the threader under the brace's wire, bringing one end of the floss through. Grip the floss end and wrap it around the finger inside your mouth. Wrap it around the finger outside of your mouth so about an inch is between your two fingers. Wrap it around one in-between surface, making a C. Scrape the floss up and down, removing the plaque. Move the floss over the gum papilla and hug it up against the other in-between surface. Scrape up and down. Let go of one end of the floss and pull it out from between the teeth. Reinsert the floss in the next area and repeat the steps. It does take practice.
Chapter 8. Flossing under a fixed retainer.
How do you floss under a fixed retainer? The wire in your retainer that is used to keep your teeth straight makes flossing more difficult. Thread the floss between your teeth and under the retainer wire using floss with a threader. Wrap it around one in-between tooth surface, making a C. Scrape the floss up and down, removing the plaque. Do not lift up on the retainer because this will cause it to break from the tooth. Flossing under a fixed retainer. Thread the floss between your teeth and under the retainer wire using floss with a threader. Grip the floss end inside your mouth and wrap it around the finger that is also inside your mouth. Also wrap it around the finger outside of your mouth, so about an inch is between your two fingers. Wrap it around one in-between tooth surface, making a C. Scrape the floss up and down, removing the plaque. Do not lift up on the retainer because this will cause it to break from the tooth. Move the floss over the gum papilla and hug it up against the other in-between surface. Scrape up and down. Let go of one end of the floss and pull it out from between the teeth. Reinsert the floss in the next area and repeat the steps.
Post-Test 1. For individuals without braces, Chapter 1 through Chapter 6 in the Basic Oral Hygiene module.